The word yoga has its origins from the word yuj, which means unite. "6,000 years ago, yoga originated as a spiritual lifestyle in our country. Yoga is a means to unite the body and mind, thought and action, and to create internal harmony. In the spiritual sense, it unites the personal consciousness with the cosmic one. Today, most people see yoga as a set of postures and a few breathing practices, while some others consider yoga as a form of meditation. Neither of these is completely true. Yoga is a holistic lifestyle with many principles. Asana and pranayamas form the physical part of the practice. In the 4th century BC, sage Patanjali laid systematic foundation of classical yoga. In his Yoga Sutras, Patanjali emphasized on advanced meditative techniques. Later on, Hatha Yoga evolved as a preparatory step for classical yoga of Patanjali. Hatha Yoga mainly focused on physical postures and breathing techniques. Another important yoga text, Bhagavad Gita, defined yoga as a state of equanimity of mind in success and failure. The National Institute of Mental Health and Neurosciences, NIMHANS Bengaluru, has been a pioneer institute for psychiatric and neurological services in India. Research in yoga has been going on in NIMHANS since the early 1970s in the Department of Neurophysiology and Clinical Psychology. In 1990s, the work was continued by the Department of Psychiatry in collaboration with Art of Living Foundation. Considering the popularity of yoga, it was thought essential to establish a yoga clinic and research center in specialized fields of medicine. Yoga services as the therapeutic intervention in the hospital began with the setting up of the Advanced Center for Yoga in Mental Health and Neurosciences in 2007. The Morarji Desai National Institute of Yoga, MDNIY, New Delhi, supported and collaborated in this endeavor. NIMHANS later integrated the center as a part of the institute itself as the NIMHANS Integrated Centre for Yoga, which was established in 2014. NIMHANS is the only institute to have a dedicated yoga center for mental health and neurosciences. On December 1st, 2016, yoga was listed by UNESCO as an intangible cultural heritage. In the field of medical science, several studies indicate the physical benefits of yoga. Recent researchers have demonstrated yoga to be a powerful means to reduce depression and anxiety. Regular practice of yoga causes a reduction in the stress hormone cortisol, increase in the cuddle hormone oxytocin. A neuroimaging study on healthy person showed that chanting Om reduced brain activation in areas related to emotional control, suggesting that it has a potential to calm emotional disturbances. Scientists have studied the effect of yoga on nervous system as well and have observed that there is a structural, functional and chemical change in the brain of people who practice yoga regularly. Through this practice, the functioning of the brain becomes better, the autonomic system stabilizes with increase of parasympathetic system functioning. This in turn has effects on other organs as well. As a consequence, yoga practitioners experience a high degree of psychological well-being and demonstrate increased competence in their skills. Yoga is known to increase markers of brain plasticity such as brain-derived neurotrophic factor (BDNF). It helps prevent degeneration of brain cells or even an increase of brain volumes in areas of memory, hippocampus, especially in the elderly. Depression is the most common psychiatric disorder. Initial work was done to look at the effect of yoga on depression. It was found to be effective in reducing the symptoms of depression, almost equivalent to antidepressant medications and ECT. It has been found to be effective in anxiety disorders also. Further advancement in yoga-related work was done in collaboration with the S. Vyasa University from 2000 onwards. Schizophrenia is one of the severe mental disorders. Despite significant advances in pharmacotherapy, treatment remains suboptimal, with many patients having persistent deficits, especially in cognitive and socio-occupational functioning. Yoga as a therapy has been proven to be effective in improving cognition and negative symptoms in schizophrenia. New facilities including 2 new yoga halls, updated research facilities and digitized data recording have been set up at NICY and were inaugurated by the Secretary, Ministry of Health and Family Welfare, Government of India on 29th August 2017. NICY is located in Ayush block. Ayush stands for Ayurveda, Yoga, Unani, Siddha and Homeopathy. NIMHANS also houses an Ayurveda center which is run by CCRAS, Central Council for Research in Ayurvedic Sciences. Despite several challenges in adapting yoga in clinical practices, the NIMHANS Integrated Centre for Yoga has made several efforts in this direction, wherein psychiatrists and neuroscientists have collaborated with yoga experts from S. Vyasa and MD-NIY, Government of India. This has led to the development and validation of specific yoga modules for disorders such as depression, cognitive impairment in elderly, and schizophrenia. Mr. Dhirendra Brahmachari came up with the idea of having advanced centers of yoga in medical institutions. They chose NIMHANS, JIPMER, and DIPAS. The idea was to collaborate with well-known medical institutions to conduct research on yoga as a therapy. As part of this research, NIMHANS got a grant for 5 years from MD-NIY, and this research project was completed in 2012. In 2013, a whole supplement of Indian Journal of Psychiatry was published exclusively on articles on this research. Swami Vivekananda Yoga Anusandhana Samsthana SVYASA is a UGC recognized deemed university working for making yoga as a socially relevant science based on the teachings of Swami Vivekananda. NIMHANS Integrated Centre for Yoga NICY. As part of NICY, various activities are conducted continuously. Clinical services, training, information, education and communication, and research. The patients are referred with referral letter from their respective treating team. At the NICY, they are evaluated in detail by the doctors initially. After confirming their fitness to practice yoga, they are allotted to a particular yoga session batch depending on their diagnosis. Yoga card is issued to them which contains their demographic details along with diagnosis, therapist name, session timings, instructions for sessions and attendance. All patients receive individual counseling and orientation to the practices before joining group yoga practices. The sessions are taken by a well-trained yoga therapist. Apart from patients, caregivers of patients are also given yoga therapy which helps to reduce their stress. All the patients, caregivers undergoing yoga therapy are assessed on weekly basis till 1 to 2 months of practice to look into feasibility, benefits and side effects of yoga. At the end of the yoga training, they are given the yoga module, either hard copy or soft copy, to help them practice at home. They are also advised to come for booster sessions when they come for their clinical follow-up. Effective yoga modules are designed for various psychiatric and neurological disorders using traditional yoga literature as well as modern methods of validation. Our thrust in last 4 to 5 years has been to come out with generic yoga modules for various neuropsychiatric disorders. This concept has been brought forth by us to promote standardization and scientific growth of yoga as therapy. At present, we have scientifically validated and tested generic yoga modules for following disorders: depression, schizophrenia, obsessive compulsive disorder, mild cognitive impairment, Parkinson's disease, and somatoform pain disorder. We are in the process of validating the modules for substance use disorder, anxiety, and migraine. NICY has provided the opportunity for the students to do their thesis in the area of yoga. A yoga appreciation course is held quarterly for training staff and students of NIMHANS. More than 20 courses have been held till now and they are widely appreciated. NICY has trained more than 35 nurses and other mental professionals from NIMHANS and other hospitals to teach yoga to patients with neuropsychiatric disorders. As a part of IEC activities, for the past 4 years, the NIMHANS Integrated Centre for Yoga has been celebrating IDY at NIMHANS with the several activities. Special additional activities like walkathon, movie quiz, painting competition, Krida Yoga, and guest lectures are conducted during International Yoga Day every year. We have collaborated with Vishweshwaraya Museum, Bengaluru for organizing yoga exhibition during IDY celebrations at NIMHANS. We also have NICY website, virtual yoga sessions, video interviews for general public, YouTube, panel discussions, etc. Research at NICY has predominantly focused on following objectives: development and validation of generic yoga modules for common mental and neurological disorders, study of efficacy of these yoga-based intervention modules in specific psychiatric and neurological disorders, scientific study of the mechanisms of action of yoga in these disorders. The center has conducted controlled trials of yoga-based interventions for patients with depression and demonstrated that yoga has antidepressant efficacy with no significant adverse effects. In patients with schizophrenia, which is severe mental disorder, the center has conducted pioneering research studies, randomized controlled trials, which have shown that a generic yoga module can reduce symptoms and improve quality of life as an adjuvant treatment. This research has been internationally recognized under 2014 guidelines issued by the National Institute for Health and Care Excellence, UK. NICE guidelines have credited these studies by recommending yoga as a complementary treatment approach for patients with schizophrenia for the first time. Similarly, other researches done at the center have shown that yoga-based interventions reduce symptoms in patients with OCD and somatoform disorders. Studies in family caregivers of patients with psychosis and severe neurological disorders who are under the tremendous burden also showed significant benefits such as reduction of burden and improvement in quality of life. This is an area of research which is very important to place yoga as an intervention on a sound scientific footing. Work done at NICY using modern techniques such as blood levels of hormones and neurotransmitters, functional magnetic resonance, imaging, fMRI, and functional near-infrared spectroscopy, FNIRS, has thrown light on several biological mechanisms underpinning the clinical effects of yoga in healthy individuals and in disorders like depression, schizophrenia, and elderly with mild cognitive problems. In patients with schizophrenia, yoga practice was shown to improve social cognition, which is possibly mediated by increase in the neurohormone oxytocin. Further studies on the molecular and genetic effects of yoga in depression and schizophrenia are currently underway in the center. Majority of the patients give a positive feedback about yoga and most of them recommend it as an add on their routine care.